On the 6th of February a year ago, the President Muhammad Buhari launched the CHIPS program. He also directed that we roll it out in 36 states plus FCT, spearheading the strengthening of the community component of primary health care, which we know globally is one that would help us achieve universal health coverage. This program will contribute to the reduction of maternal and child morbidity and mortality by creating demand for the equitably increasing access to essential primary health care services. This meeting aims to acquaint the key stakeholders here with the CHIPS program, increase the visibility, align on the need to scale up the program across the country, and to confer also champion awards to a few of our numerous individuals who have made appreciable efforts in the areas concerning health and well-being of women and children in our communities across Nigeria.
That, the CHIPS initiative just finished 1 year. And with this 1 year, we know the ups and downs, and finally the CHIPS has been deployed in Nasarawa state, and it is a grand success, and we should celebrate it. While CHIPS initiative first tabled, we know there are many skeptics around that whether it will be implemented or not. And there are huge enthusiasts about CHIPS, and we know that the CHIPS is going to be a reality. And today the CHIPS is a reality, and I'm sure that the CHIPS agent is going to be the game changer for Nigeria, changing its narrative about maternal health and neonatal deaths or many other public health initiatives.
We will not repeat the same mistakes. This is why for the CHIPS program, we're mobilizing, we're harnessing all of those polio resources and now focusing on maternal and child health. Later today, you'll hear about how increase in the number of women who are attending antenatal care. That is massive. Please give the CHIPS program a round of applause. That gives us a lot of confidence that we're on the right path. Last year was a giant step towards strengthening primary health care through community health programs. But we know as we roll out the CHIPS program all across Nigeria, hopefully rolling out in all the states by December 2019, that we'll be making a giant leap when it comes to providing basic health care. But don't believe everything I say. Wait until you see the data when Dr. Nana presents them. Wait until the end of 2019 when you see how we'll make massive shifts when it comes to basic health care. I want to finally wrap up by once again thank you the honorable ministers for their presence. I understand the UNICEF country rep, who has been a huge champion of CHIPS program, is unavoidably absent because of the event organized by the Nigeria Governors Forum. Somebody should remind me not to be very nice to those guys. So, distinguished ladies and gentlemen, as we take the opportunity to review the CHIPS program, let us also take one step backwards to reflect on the lives and the sacrifices of our CHIPS champions, because today's event is in their honor. Thank you very much.
The Federal Ministry of Health, working with the National Primary Healthcare Development Agency and the state governments, have taken preparatory steps to implement the program. Yet, there is the need to gain the support of all stakeholders across various sectors towards making the program well-resourced and sustainable. The inclusion of a female empowerment component as one of the principles of the program is clearly targeted at leveraging the program to achieve the educational and economic empowerment of women serving as chiefs agents. In this way, this component will contribute to transforming their household economic status and promoting sustainability. Achieving this requires that programs that relate to gender empowerment across sectors are deliberately aligned with the CHIPS program. This program, no doubt, complements the primary healthcare revitalization efforts of the Federal Ministry of Health, which aims to make at least one primary healthcare center per ward functional. With an upgraded and equipped facility, having the needed drugs and adequate competent and motivated staff, these facilities will serve as referral sites for the demand for healthcare services being generated by the CHIPS agents in the communities.
Thank you very much. Last but not